I'm just going to speak to the reality of what abortion is like for healthcare professionals and the right to have full conscientious objections. Now, I'm just going to pre-warn you, there are some graphic diagrams, not full pictures, but graphic diagrams. So I work in operating theatres, principally in obstetrics, gynaecology, and in fetal surgical procedures. So this is some of the stuff that gets done on our unborn babies. So this is for spina bifida, between 19 and 25 weeks. Now the babies do get anaesthetised because science says they feel pain, as well as the fact is we don't want them moving while we're working on their spines. And you can see, look, the theatre, how much is involved and how much we fight for these babies. And, in the picture down the bottom with the little hand, these little tiny babies. So, and then we sew it back up and they grow and are delivered later on. Another procedure that is done is called the twin-to-twin laser, and that happens for identical twins where the blood vessels in the placenta don't distribute the blood evenly, so you get one baby that gets too much and you get one that doesn't get enough. So we put the lasers, you have cannula, like if you're having your gallbladder out, they put some ports in, we put the scopes in, and this is what we see. So their little face and nose up the top, you've got little feet and toes, fingernails are on them, you can see. And we laser the blood vessels so that you get even blood distributed between both babies. And we also have tertiary nurseries. So we have the babies, you've got 24 weeks, 28 weeks, 32 weeks, and then you go all the way up to term. So, and obviously you have a whole hospital staff working to ensure these babies grow up. I myself had I had 33-week twins, one baby of which was diagnosed as 20-week with a life-limiting condition, and I was offered a selective termination. I did not choose a selective termination for a number of reasons, but I now have, William is 11 and Christopher's saving me a spot with a view upstairs. Now, this is the realities of, so assisting abortion. This legislation basically says this is a termination of pregnancy in any way, including administering a drug or using an instrument or anything. There isn't a third option, would be a delivery. But this law is essentially the 1973 of Roe v Wade, but we have learnt a lot in the last half century. So this legislation doesn't have a Born Alive Infant Protection Act. So any baby that survives their abortion, there is nothing to ensure that we'll provide life-saving treatment to that child. The Pain Capable Unborn Child Protection Act, which acknowledges that babies feel pain beyond 20 weeks, so maybe we shouldn't pull them to pieces. Then we've got partial birth abortion ban. So it's a type of termination procedure that has been banned in other places. The Women's Right to Know Act, which has come about as we've learnt the harms of abortion, to ensure that women have fully informed consent. And then the Coercion Protection Act. So the right to freedom of conscience, freedom of belief, that's all within human rights, and I believe it's extraordinarily important as a civilised society. Now, if you're assisting or performing a first trimester abortion, this is what you're going to see. If you look at the ultrasound to work out the development of the child and the age, you're going to see all of their little limbs, so that's a 12-week. You've got spinal cord, you can see brain right in the middle there, you'd be seeing the heartbeat and their little legs, and it'd be all moving around. Now, up to about 12 or 14 weeks, the bones aren't calcified, so you dilate the cervix artificially. That can damage the cervix, and so often, and that we, at about this point or later, to keep a baby in, you'll do a cervical suture or something like that where you've got an incompetent cervix. So you would artificially dilate, then you stick the sucker in and you turn on the suction, very high suction, and out comes the baby. So assisting in a second trimester abortion. There's D&E, called a D&E abortion. This is sort of what's banned beyond the 20 weeks as well as the partial birth. Their bones are calcified, so they don't fit, and they don't fit through the suction. So to do this, as you can see, you're going to have to put in a grasping and you've got to pull the baby out in pieces. And as the nurse, I have to account, or I would be expected to, it's never going to happen, but I would be expected to account for all those pieces, because we need to make sure you're not leaving anything behind that's going to cause the mother an infection, and to make sure that you haven't perforated the uterus or anything like that. And basically one of the abortionists that's spoken about this says, you know, it can be particularly troubling for nurses as well as doctors, because there's no possibility of denial of an act of destruction by the operator. You can feel it flowing. It's like an electric current when you pull them apart. And that's a 24-weeker up there. So assisting with the second and third trimester abortion, that's 25 weeks up until birth. You could probably do it earlier as well, but basically this legislation says, you know, a medical practitioner can perform to 22 weeks, have you heard, for whatever reason. Beyond 22 weeks, it's basically, you know, anything that they, in all circumstances. So I don't know when it would be considered not appropriate if two people agree. Now, you've got two options. You're either going to lethally inject with digoxin and then you're going to do a delivery, or a partial birth or cranial decompression where you dilate the cervix over days. It takes a few days to do, and then you pull the baby out feet first, puncture the back of the neck and suck the brains out. Now, this was just a video of a nurse that was talking about the impact when she was forced to participate in a D&E abortion. She has nightmares. I've spoken with fellow staff. The concept gives us nightmares. And she was just talking about how she had to account for all the pieces. Abortion is not just another medical procedure, because we know that it involves two bodies. You can basically see where, you know, you've got a 20-weeker that's considered a non-person, then you operate and they're a person, and then you sew it back up and they're a non-person. So and the purpose of this Act, the conscientious objections provisions are a bit weak and ambiguous. They don't define what emergency situation means. And basically it's to regulate your conduct, denying full conscientious objections. Frank Brennan, former head of the Human Rights, said that it basically carries the hallmarks of totalitarianism. And when you've got to start putting things into human rights charters such as, you know, none of this applies to child destruction or abortion, then I think we need to tread carefully. There's a reason that it's there. And these are just a couple of the current law allows, as you've heard, 14,000 abortions a year. Basically, it acknowledges that the unborn's a human being. It covers our full conscientious objection, our freedom of speech, belief, and our human rights protected in law as a health professional. It acknowledges that abortion is the intentional ending of a life, and therefore we shouldn't have to participate. And basically, if we're going to modernise the current laws that we have that seem to be working all right, then it needs to be based on what we've learnt in the last half century, and based on international experience, on modern science and on human rights and the harms to women, the harms to unborn babies and the harms to the social fabric of our society, and build better ones. Thank you.